when the time comes there.
Those
So
little amounts.
That's what I was giving you.
we will call, I'll call the meeting to order and welcome everyone to our steering committee meeting. Thank you. We do have the minutes from the last meeting. I've attempted to do an electronic vote on the minutes, but I'm not sure that I did it correctly. When I sent out the email, I tried to put voting buttons on there, but I didn't see any replies. So we'll.
Motion to approve the minutes.
Here we go. We have a motion by Representative Jean, a second by Representative Gray. All those in favor of approving the minutes, please say aye.
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 Very good. No opposed? Any opposed? Thank you. The minutes have been approved. Now, I just wanted to go over our funding to date and where we stand. We have calculated the funds that have been recommended so far, and I'll let Secretary Walther go over this too, but from my calculation, Secretary Walther, tell me if I've got this correct, but I show $437,911,526.28 is the total amount of funds.
Don't be
we
so
recommend.
precise, but you're close, but not quite on top of it.
Okay, well, please correct me.
We should have talked before the meeting. I have a $439,370,746, and I didn't put the cents on there because I don't like to talk that low when you're talking in $400 million terms. I would also, so we have approved as a committee of $439,370,000 that have been brought to the committee. There are another possibility of about $626,837,000 if you consider us setting aside $250 million for contingency in the latter part of this year, and we put $150 million aside for the cities and counties, and then adding to that known requests that are in evaluation at this time. So that would bring the total to $1,066 million, with a remaining balance, if all of those were approved, of $183,792,000. So, but that, again, that's with $400 million set aside for cities, part of it for cities and counties and part of it for contingencies toward the latter part of the year. When I looked at it, decided to look at it in a category like health and the economy, we have committed $212,520,000 to health so far. And we have another $143,817,000 in evaluation, which would mean if we approved all of the things that the health area, and that health includes DHS, Department of Health, and UAMS, that would add up to $356,338,000, or about 29% of the $1.25 billion. And I know I'm throwing a lot of numbers out there, but I hope that y'all can get this in perspective. The economy, we have the commerce, and then we have the Department of Parks and Tourism, and that's total amount that we've committed to those two is $148,359,000, and there's another $25 million that are to be considered, and for a total of $173 million. That's about 14% of the total. So that's kind of where we are today. I guess the main takeaway would be we have committed to date, let me get the number, $439,370,000. We have set aside that much for specific projects. Anybody have any questions? Having said hearing none.
Thank you, Secretary Walther. Oh, I appreciate you giving us those numbers. We do plan to have a discussion at the end of this meeting about our funding goals and about the reserve amount that we want to maintain. So anybody have any questions of Secretary Walther right now related to his report? Or do we want to just hold off and have more discussion on that as we...
Madam Secretary, is it possible we could get copies of that emailed to us?
I can do that. It's actually on a blue line and pencil right now, so I'll have to put it together.
Okay,
but I'd be more than happy to do that. I will get it to the chairman and ask her to distribute it to the committee.
Thank you.
Yes, sir.
Any other questions or requests? Okay, go ahead.
Thank you, Madam Chairman. A quick question on the, did you say 150 million to cities and counties?
Yes, Senator, that was, we actually got a letter from them, I believe earlier this week, and they asked us to set aside $150 million for cities and counties. And, but there's not a specific proposal for what that would, how that would be spent and on what.
Yes,
Okay.
so we do have, we have a document that we received late Monday. And what my plan is to give to all of the committee members by tomorrow, fairly early in the day. I plan on sending out all of the information that has been sent in either to me or to the governor's office related to requests. I think that's where Secretary Walther is getting these numbers. Some of the requests that we have received have not been very definitive. They haven't given us specific needs. Some have given us specific numbers, but they haven't really backed that up with what it, what all adds up to that. Or they've said we would like funding, but they haven't even given us an idea of what that is. So what we'd like to do is give you guys all the opportunity to see those and have the opportunity to go through that as well.
Madam Chairman, go ahead, Senator.
Just one thing that I know that we talked about is, do you have percentage of what has been spent like on government versus, and what has been spent on private sector? I think that would be an interesting, I think that would be an interesting thing to have.
Could I suggest we look at how much we've committed as opposed to spent? Because I don't think we can identify the spending levels at this point in time.
Yeah, that's
accuracy.
Yeah, no, that I agree. That would be great. I think that would be an interesting thing to, as commitment. That would be good. Thanks.
Yeah, the preponderance of our spending so far has on government has been for PPE, I believe. Right.
Yeah.
And it's been significant. We committed a significant amount to PPE.
Right. Thank you.
Okay, is there anybody else who has any questions? And yes, I think we can make those calculations, and I probably will work on getting a chart that we can look at so we can see what the percentages are in different areas. Anybody else before we move on to the proposals?
You're not needed, though.
Right, I'm fixing to talk. Am I up next?
Yes.
Again.
I'll turn it over to a request from Secretary Walther. You still have the floor.
Okay, on April 29th, one of our first, maybe the first steering committee meeting that we had, we brought up and discussed the issue of PPE and for the agencies, and the $1 million number was thrown out. We did approve the list of items that would be covered, pre-approved for PPE. And that actually was voted on in that committee meeting, but we never voted on an amount of money that we would use to pay for the PPE. We now have a request specifically in that has been spent to date of $3,162,500 $593.49. So we, beg your pardon? That's money that's already been spent that's from 5 different agencies: the Administrative Office of the Courts, the Arkansas Department of Emergency Management, the Arkansas Department of Agriculture, the University of Arkansas Medical Science Center, and the Department of Veterans Affairs. And all those total, 1, 2, 3, 4, the 5 of those total up to $3,162,539. We believe, and we also believe there's a significant amount more that's already been purchased that has not been submitted for reimbursement. And so we would respectfully ask this committee to approve a $5 million set aside for PPE and pre-approved items so that we can reimburse agencies as they submit those requests. There's another request that we approved last week for the transformation and shared services. That's for new purchases that Secretary Fetcher submitted last week that we approved. We do not believe there's any overlap, and we'll make sure that there isn't as we go through. But we believe we need $5 million in total to cover purchased PPE to date. That's my recommendation.
Question.
Go ahead.
Okay. If my memory serves me correct, at the beginning at our first meeting, we approved a substantial dollar amount to go back to DFNA for purchase of PPE. It was my understanding that DFNA was buying the PPE for the state of Arkansas, which included various agencies.
Okay, with regard to that, you are right in one way. We had a substantial amount of money. It was $73 million was set aside, and those purchases are being made by UAMS on behalf of the state. And those once that is purchased, it is sent to Adam for distribution around the state. These are specific purchases that were made by agencies that needed it at the time. So this is money they spent outside of the initial, those larger numbers that we had initially done back in April, I think in our first meeting.
So these 5 agencies was not included in the total amount that we allocated.
No, sir.
Is that correct?
That's correct.
Okay.
And I may be getting something from the Department of Human Services, because I had a conversation with Cindy Gillespie a couple of weeks ago, and they had purchased some on their own because they have a lot of health facilities that needed it and needed it immediately, and so they went out and made procurements on the spot around the state to protect their workers.
That's correct. If I could just thank you for mentioning that, and I'll just add in. So we are finalizing those numbers to send over to DFNA so that they have that. But as he said, we needed those both for our human development centers, our nursing home, ASH, as well as all the different county offices had to have immediate sanitizer, just some of those basics that they did not have there, and our child welfare workers who had to continue their work.
That was a good question, and there's a logical answer to it. Any other questions? Can I submit my request in the form of a motion?
Larry, just one question. If we don't spend the whole $5 million, does the amount that's left over return to the fund? Does that?
Yes, sir. Yes, sir. And that's with all of these programs. All of it returns if it's not spent properly.
Thank you.
Mm-hmm.
Secretary Walther, I can make that. I can make your motion or second your motion.
What does the chairman say? Why don't you make the motion, Senator?
Okay, I'll make a motion for $5 million for the PPE for the approved list of items.
I'll second.
Thank you.
Sure.
We have a motion and second for the proposal by Secretary Walther. Is there any discussion? Y'all ready to vote? All those in favor? Aye.
Aye.
Thank you.
Thank you. Thank the committee.
Is there anyone opposed? Thank you. The motion passes. Okay, I think we have covered those. The second item I had there was related to the discussion and determination of the funding goals for the pre-approved items. So we've covered both of those. So we'll move on to our discussion and the proposals from Secretary Kelly, who is on the line and has some others with her in the room. I did attempt to send this additional proposal to everyone via email just a minute ago while Secretary Walther was making his presentation. So hopefully y'all were able to see that. I think she'll be able to explain it. And it's not a large, it is a change in the numbers, but it doesn't really change a lot of the request. I think you'll be able to follow. So go ahead, Secretary Kelly. Thank you.
Thank you. Thank you, members of the committee. We have two requests for you today, which do not include reimbursement for PPE. We have not submitted ours yet either. But the two requests that we have for you today, one is to pay a $500 payment to our staff that worked at the 3 facilities where we had COVID patients. As you may recall, at the Central Arkansas Community Corrections Center, we had 63 residents and 27 staff that tested positive for COVID, and we actually lost a staff member at that facility. At Cummins, we have had to date 963 inmates and 65 staff, with 8 deaths of inmates at that facility. And at Randall Williams, we've had 227 inmates, 15 staff, and 1 inmate death. The total request for the $500 bonus for the ADC staff that worked a minimum of 40 hours during the time we had an active pandemic at the facility is $301,500. That is the first request I have. The second request is for our healthcare provider, WellPath, and it's for their staff that worked at those 3 facilities, including staff that were sent to work at those facilities when we were short or we were trying to do the mass testing clinics. And that total, which is what is changed, initially what was submitted by us for WellPath was for all of WellPath's staff, except for the higher paid physicians. And that was about $1 million. We went back and we made it consistent with the ADC request. So we're only requesting it for the WellPath staff that worked at those same 3 facilities or did testing clinics there. And that dropped the request for WellPath to $206,400. So it's a total between the 2 requests of about $500,000. And I'd be happy to answer any questions.
Thank you, Secretary Kelly. Does anyone have any questions?
I have a quick question.
Yes, ma'am.
Are any of your physicians being furloughed or laid off as a result of budgetary issues? Or the reason I'm asking is because a lot of physicians across the state have been furloughed or laid off or hours cut. So I just wanted to ask.
No, ma'am. We don't do elective type treatment in the facilities, so there's been no reduction in the medical needs at our facilities. If anything, there's been an increase.
Okay, yes. Okay, thank you.
Yes, ma'am.
Is there anyone else that has a question for Secretary Kelly? Representative Allen, do you?
No, no question.
Thank you. Promise I'd reach out since you're on the phone. Anyone else? Okay.
I would move that we accept these 2 proposals as presented by Secretary Kelly.
Thank you. We have a motion from
Second.
and the second by Lane, Representative Jean.
It is for $507,900.
Thank you. 500 and,
$507,900,
Yes, sir.
if you total the two together.
thank you. $507,900 for the joint proposals by Secretary Kelly. Any discussion? No? Okay, let's go for a vote. All those in favor?
Aye.
Aye.
Thank you. Any opposed? Thank you. Secretary Kelly?
Thank you so
Your
much. Appreciate it.
You're welcome. Thank you. And I appreciate you doing that extra work to do those additional calculations. I appreciate that. Okay, so our next, and Secretary Kelly, you are welcome to continue on joining us, but you may have other things you need to attend to, so you're welcome to step out if you like. Our next proposal is from Secretary Gillespie, and it relates to the Arkansas hospitals. And Secretary Gillespie, we also have Ms. Tritt on the line too, if you would like to have her answer questions or provide information. So, Cindy?
All right, thank you very much. And in addition to Jody and Tritt from the Hospital Association, I believe Bud Ryle is also on from AHA to help answer questions. This is a significant proposal, and I know you've all looked at it. I want to walk through and highlight a few things, and then we're happy to answer any questions you have and discuss it. We've been working, I think I want to start by, in the room with me today, I do have our senior advisor here, Dennis Smith, and our chief of staff, Mark White. Dennis has worked extensively with AHA over a period of several weeks to develop this proposal. We did not rush out of the gate with a proposal around the needs of hospitals in the state related to being able to respond to the pandemic. It's something we've worked on for a while, as I said, and also waited to see what would happen with federal monies that would come down to be able to deal with some of these some of the activities that had to take place in the emergency. It's a very focused proposal designed to address the very specific expenses that the hospitals in the state incurred in responding to the first months of the pandemic. This essentially covers expenses incurred between March and June 30th. And there are, as you see on page 2, 6 very specific areas in which those expenses fall. We can talk through examples of some of the types of activities, but as all of you probably have seen and heard, one of the things that happened in the state was the hospitals did a great deal of conversion in order to be able both to continue to maintain safety of patients, safety of visitors, when there were visitors allowed, and safety of staff. And that was everything from shifting to doing a lot of the initial triage outside of the four walls of the hospital, changing the patterns for entry. You know, this is well beyond PPE. These are actual changes made to the way they operate. Part of the discussion here around technology improvements is the shift that had to be made to providing services through telemedicine in many areas. Education and training, it's funny, I would like to actually ask Jody Ann, if you wouldn't mind. You have a wonderful explanation on education and training that I think really helps to showcase the innovative way our hospitals went about responding to this emergency and continue to do so. Jody Ann?
Hey, I'm here. Thank you for the opportunity, and thank you to everybody on the Our Cares Committee for all the balancing act that you're doing right now with all the different that you've got from various places around the state with people who very much need your assistance. Secretary Gillespie is correct. I'm awfully proud to get to work for our hospitals every day. But during a pandemic, it's really neat to see how we innovate and do our best to make sure that patient safety, as always, is number one and in the forefront. So education is one of the things that came to us really quickly to be able to say, okay, as we're doing less and less elective procedures that give our hospitals opportunities for reimbursement, we also realize that you don't want to let go or have to furlough your frontline staff in large numbers, because those are the very people you're going to need if a surge does come. So what our hospitals did very uniquely is, if you had a nurse, for example, who was kind of typically doing an administrative job and maybe hadn't been at the bedside for a while because their services were needed in more of an administrative role, the hospital took it upon itself to train that nurse to then work at the bedside, which then enabled those nurses that had been working at the bedside, but likely not in an ICU area, to be able to work in an ICU area. So you'd train the nurse who was at a regular bedside to be a nurse at an ICU bedside. And then it gave us an opportunity to take those nurses who were really great in the ICU, but maybe hadn't trained on a ventilator in a while, to give them additional training so that we were ready to take our ICU ventilator opportunities even up a step, to have those nurses trained in that way. So we up-trained all of our employees within our hospitals, but the nursing one is the easiest one to kind of talk about. And it made us really proud and really understand all that our hospitals do on a day-to-day basis to ensure patient safety and to ensure that education and training is paramount and at the top of all the priorities we have on an everyday basis.
And as y'all know, when we talk about readiness and preparedness, you've heard many examples, and we can talk about many others, but the shift that the hospitals had to make to be able to be prepared for the surge that would come, or that was expected to come and hopefully will not, in this period of time, it meant that there had to be shifts in, they went ahead and took actions to, for example, go in on certain areas and shift to have negative flow of the air in case they had to have COVID positive patients in that way, to even little things such as being able, we talked a good bit about how we've all had to go into hospitals and put in plexiglass in different areas, just from simple to very complex changes. And then the final area that's mentioned here, incremental, direct and indirect costs. There are just so many specific costs that you look at. Give you a simple example, following on Secretary Kelly. For the inmates that wound up having to be hospitalized, not only are there costs associated with hospitalization that, as we talked about here, are not completely covered for a COVID patient by the normal cost, what you pay for a hospital stay, but think about in the case of an inmate who is hospitalized, you also have costs around the fact that you have to have guards on that inmate. They just don't go into the hospital and go into the general population. And there are costs with having that type of a patient that have to be taken into account. Working with them, what we came up with was a formula that creates an allotment for each hospital in the state that they can use to pay for the cost incurred in these specific categories. And as you see, that allotment is $50,000 for critical access hospitals and specialty hospitals. But for acute care hospitals, we're doing it based on licensed beds. And that allotment creates for each hospital then a capped amount that is the maximum that they could request from DHS. We would then, the way this will work, addressing some of the issues that we've all been concerned about, which is to make sure that we don't have money out there that isn't spent when there are needs. This creates a maximum allotment. Each hospital then, by the end of this month, if this is approved by the committee today, and then if it's approved by the governor and the legislature for this amount, that allotment would be available. And by the end of June, each hospital would need to make a request for the amount of their capped allotment that they believe they need to reimburse themselves for these types of expenses that are not covered by other federal or state sources. And so we would know at the end of June, by the first week of July, when we made these payments, we would know how much of this total amount had been requested by the hospitals. So if the entire amount is not requested, that money would remain CARES fund. Then what we're doing is by the end of August, the hospitals all have to submit detailed cost reports that actually are used to reconcile those expenses that they are using this for reimbursement. And I think what's really important about the way cost reports work is those also take into account revenue sources. So if there are other revenue sources that are used by a hospital, they cannot double dip, and they have to use the other federal sources before they can use these sources. So those are all due back to us by the end of August, which means that even from the initial capped allotment that we started with, if along the way, somewhere in July and August, other sources come down from the federal government or from other state sources, then the hospitals will have to claim against that first. And we would be able in September then to request that money back from the hospitals that it turned out they no longer needed. So that would allow, we've tried to stage this in a way that it gives the hospitals the reimbursement they need, but also ensures that CARES money comes back in time to be reused this fall if it actually is not needed or other federal sources come into play. The other component of this is $10 million for what we're calling COVID-19 cluster payments. This is similar to what we did with the nursing homes. And this recognizes that for the hospitals that are, that do have COVID positive patients, as we said, the payment that they receive, it doesn't really cover the cost of that type of an inpatient stay. And so it does allow money to be there, and it would be allocated among the hospitals that do have a COVID positive patient between March and the end of June. We note in there that it would be prorated if it turns out that when we do the allocation, it's not a guaranteed amount per patient that they had. Instead, it's $10 million that ends up being split up among them. And it's just prorated in that way based on the number of patients that we end up having by the end of June. So those are really the two pieces of this. At the beginning of the document, we talked for a good bit about what's happened with federal money coming into the hospitals here to offset some of the costs. And the bottom line, and we can certainly talk more about this, but the bottom line is that the way the federal government has wound up doing the formula allocations, Arkansas has been we've been disadvantaged because our bed rate is low here, which is great. But at the same time, it means that other states have gotten far more money than we have gotten. So with that, I will stop, and Bo, Jody Ann, and I will be happy to take any questions.
Thank you. Thank you very much. We do have a question here in the room from Representative Dean.
Secretary Gillespie, do we have an idea of what the total amount that all our hospitals got earlier from federal funds?
I'm going to turn that one over to Jody Ann because I believe she and Bo do have that information. They gave it to me earlier today, but I'll let them do it so it's accurate.
Hi, Representative Jean, this is Jody Ann. Yes, as of May 13th, the information that we can tell from state and federal sources, our hospitals have received about $216 million from HHS at the federal level. So that's the CARES Act. That's tranche one, which was based off of Medicare fee-for-service payments and patient load compared to everybody else in the country who had Medicare fee-for-service patients in their patient load. Then tranche two dealt with net patient revenues, and Secretary Gillespie did a really great job of explaining that net patient revenues, when your costs are low and when you're reimbursed second lowest in the country, and the formula at the federal level is based upon net patient revenues, you're very much left behind. People who got paid more received more from that federal disbursement. Then we had a rural payment that was added for about 49 small hospitals, and all of our critical access hospitals benefited from that. So out of that $216 million, hospitals benefited in various ways from that tranche one payment, tranche two payment, and then the rural allotment that was there. In addition to that HHS CARES dollars that flowed through to us, about 28 of our small rural hospitals also had the ability to get a community development block grant in collaboration with Secretary Preston and some of the work that they've done. Those awards ranged from $150,000 a piece all the way up to $500,000 a piece. And they're based on cost in collaboration with the county judge, signing a contract in collaboration with the hospital to be able to reimburse some of those expenses that the small rural hospitals also had trying to prepare for the occasion. And in addition, one more thing, I think some of our hospitals actually applied for the Ready for Business grants. So we've yet to see how those dollars are going to flow to them and to know exactly which hospitals applied and were awarded. But that's the other kind of allotment or payment cluster, if you will, that's been available to hospitals so far.
Well,
Yes.
so the 216 million, that was real dollars. That's just not a commitment.
That's correct. That's real dollars.
Okay. Thank you.
You're welcome.
And as I understand what Secretary Gillespie was saying, and through the proposal, when we do have hospitals that received any of these funds that you have talked about, if they would, and I don't know if the term is correct, if they would necessarily conflict or they wouldn't be able to receive a CARES dollar if they received from the coronavirus relief fund that we're administering or that we're looking at, that we will see that when they have the reconciliation on the cost report at the end.
Okay.
That's what Secretary Gillespie was explaining.
Yes, that's correct. They would have to account for the money that they received from the federal government, what expenses were incurred against that. And these would have to be expenses within these categories that we limit it to that were above and beyond that. So it does allow us to ensure that federal dollars are used first before we get to these CARES dollars for expenses. Which is why each hospital will have to decide itself how much of their allotment they want to ask for at the end of this month, knowing what kind of costs they are have incurred and what they are incurring in June. I think another thing to just kind of mention in this is obviously while this proposal does provide assistance to rural hospitals, it also focuses very much on those medium-sized hospitals where we have had a number of the COVID positive patients that have had to be seen, but they have not been the recipient of much from the federal government.
Okay, thank you. We also have a question here in the room from Representative Gray. Go ahead, thank you.
Just a question on the cost report. Is on the federal funds, are the hospitals going to be required to do a cost report that's similar to that to reconcile those funds? And if so, do you know when that is due? And will these two reports be very similar?
I'm going to turn that question over to the technical experts, Dennis and Jody Ann.
Yes, they will be very similar. So again, hospitals have cost centers. And hospitals, a number of hospitals have gone to the effort of actually creating a specific COVID-19 cost center. So everything is specifically related back to that. Because the reality is we still don't really know the cost of treating a COVID-19 patient. There's variation in that. A lot of the modeling has been done off of respiratory problems, pneumonia, et cetera. But the studies really haven't really caught up with the actual cost of these things. So hospitals are required to file cost reports for Medicare and for Medicaid. So we are using what is, so this is not going to be foreign to a hospital to file. It will track very closely to what they're already filing. So again, based on discussions with folks who help hospitals prepare these cost reports, we think that they can be easily adapted and give us the information that we need to make the reconciliation.
Go ahead. And that does help some. So this cost report, is it like, are we looking at a cost report that's just March 1st through June 30th? It's going to show those COVID-related expenses, or are we going back to our fiscal year or a calendar year?
Since this is specific for March 1 to, in that 4-month period, we would look specifically at that 4-month period.
Okay. And that's, you know, one of the things we looked at is like readiness and preparedness. And I'm trying to figure out how you would justify. I'm gonna give you an example. So if you, like in a hospital, when everything gets shut down, you start triaging outside, you're not doing electives, most of your clinics are shut down, people are kind of quarantined at home, there's nobody coming out. We still have minimum, I say we because I work for a hospital, we still have minimum staffing requirements that we must, you know, that we have to keep at all the time. Our volumes didn't warrant some of those minimum staffing requirements. How do we include that into these cost reports? So I guess some of these costs, I'm trying to figure out how we will get into that cost report.
You want to take that?
I don't know if you can answer that or not.
Well, I think there is, I want to make sure we draw a very clear distinction, because we've had this discussion with a lot of types of healthcare providers as well as other areas of the economy. Maintaining capacity is not something that is covered here in the way this is written. And so I want to make sure that we are careful in making that clear. It has been a request that has been made by quite a few different types of both healthcare entities as well as non-healthcare entities, is the cost of continuing to be available even when normal sources of revenue were not there. And so this is not designed to cover that, if that helps.
Okay.
It is designed to cover expenses incurred related to readiness and preparedness, expenses related to, and that may include staff time, where staff was shifted to focus on readiness activities related to redoing, for example, the way patient inflow would work. That staff time then can be counted in there, because that staff is now performing a readiness and preparedness function. They are helping the hospital make those shifts. What they're doing now is different, but maintaining ratios, for example, would not count. Is that helpful?
Yes, that clarifies it for me. Thank you.
And to do so would be a substantially higher request. So
yes.
Again, giving credit back to the Hospital Association for staying with these specific activities that again can be reconciled. It is not just making up for volume. Loss of.
I have a question.
Yes, go ahead, Representative Allen.
Okay, thank you. at the beginning, this is for Secretary Gillespie. At the beginning of your presentation, you mentioned that there would be an average dollar allotment per hospital. At the beginning, this is for Secretary Gillespie. At the beginning of your presentation, Can you hear me?
Well, we lost you there for a second. Can you?
Okay. At the beginning of Secretary Gillespie's presentation, she mentioned there was an average dollar allotment per hospital.
Yes.
Per bed.
Okay,
So
what is the average dollar allotment per hospital?
Okay, the way we're doing that is we've divided the hospitals into two groups. So the hospitals that are critical access hospitals and specialty hospitals, which would be like a psychiatric hospital or a rehab hospital, they their allotment is $50,000. Okay, now for the acute care hospitals, those get their allotment based on the number of licensed beds that they have. So they're receiving an allotment of $10,182. It says 82 per licensed bed, and that's basically if we were to look at it and take one bed in a hospital and multiply it by 18 weeks and take 30% of that, which is a formula we came up with, that would end up being this $10,182 per bed. So basically what we will do is we will take the number of licensed beds in each hospital and we will multiply that by $10,182, and that will be the maximum allotment each hospital could request. So it is different depending on the size of the hospital.
Okay, thank you.
Secretary Gillespie, this is Larry Walther. How many hospitals are there that in the universe that we'll be dealing with?
There's slightly over 100, about 120 hospitals, about 12,000 beds altogether.
Okay, and the specialty ones, I guess the acute care and access and specialty hospitals only get $50,000. The others could get more or less.
Right. Yeah, the acute care will get more than that because they're getting it on a licensed bed basis.
Okay.
As she mentioned, the some of the federal allocations that have come down in the past have already come down, focused on those critical access and rural hospitals.
Okay.
And an example of a specialty hospital is a psychiatric hospital. So they're not.
Okay.
They're not treating COVID patients in the same way.
Okay. So I just want to kind of go back on one issue. When the lady from the hospital association was talking, I want to make sure we all understand that the money cannot be used to replace revenue that's lost. It's only for expenses incurred. And that's an important aspect. And I suspect that there will be multiple levels of oversight. Not only will DHS be looking at the expenses and approving or disapproving them, but there'll probably be internal within the state auditing will be done. And then I would expect auditing to be done by the federal authorities also as we go down the road toward the conclusion of these projects. So we need to make sure we're not trying to replace revenue, we're covering expenses. It'll be interesting. Dennis was talking about using the systems that they're used to using with regard to Medicaid and Medicare. I don't know if they approach it in such detail that they will be looking at it from the point of view that it'll be needed to be analyzed in order to determine these additional expenses that are related to COVID versus just the normal operations having to do with providing hospital care and health care from the hospital point of view that deals with Medicaid, Medicare. So there may be some additional requirements that'll be required for the proof that we're spending the money according to what the federal rules and regulations are.
Thank you, Secretary Walter. Is there anybody else have any questions? Okay, is there a motion?
Yeah, I got a motion to approve.
Okay. I think that Representative Jean has a motion.
Motion
Move to approve
Yes.
the proposal.
Hospital proposal.
Okay, thank you, Representative Jean. Is there a second?
I'll
I'll
second.
Thank you. We have a motion and a second. Do y'all have any discussions on the motion, or should I? Yes, we do have. Go ahead.
This is Representative Gray, and I would like to recuse from the vote just because I do work for a hospital system.
Thank you. Representative Gray is going to recuse from the vote. Any discussion on the motion?
Hey, this is, go ahead.
So I think Senator Bond has a question. Dr. Bledsoe, can you hang on a second?
Sure.
No, go ahead, Dr. Bledsoe. I just had a comment related to going to the ALC eventually, but go ahead. I'll wait.
I just had a comment as well, and that was that I will be voting on this, and I just wanted to make it clear to the committee that I am not an employee of a hospital. I'm an employee of an emergency management group. It's a physician group. So I'm not tied to any hospital at this time, so I will be voting on this. I just wanted to make it clear for the committee and the records.
I do appreciate that clarification. Thank you. Go ahead, Senator Bond.
Oh, I was just going to say, I think as Representative Jean pointed out, when this goes over to ALC, it would be helpful to have a good, solid explanation of all the funds that are coming in and how those are broken out. I think people just want to be comfortable that they know, where all the money's coming in from. We know the hospitals need help, and this is needed. And I just think that for the rest of the legislature, that explanation maybe in writing of the other funds would be very helpful.
Yes, sir. We will definitely put that together. We'll work with AHA to do that. That's great advice. And
That's good. That'd be a good addition. And I think if y'all could circulate that to the committee, if you could send it to me, I'll circulate it to the committee as well. Anything else? Any other questions, discussion? No? Okay. Are y'all ready for a vote? Yes. All those in favor, please say aye.
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 Thank you. Any opposed? No. Thank you, Secretary Gillespie, and the Arkansas Hospitals. Your proposal has passed. Thank you both, Ms. Trett and Mr. Ryle, for joining us on the call. Thank you. And y'all are welcome to stay on or go ahead and go about your daily business. We do have a few more things to cover before the end of the hour. So if we could move on, we began the meeting with Secretary Walter kind of giving us a statement as to where we are. And then I did want to let y'all know, we kind of gave a little bit of a taste of some of the proposals that we have received. And just to be frank and open, I have received a number of, I kind of mentioned this before, is I've received some proposals, and a lot of them weren't really, some of them aren't really in a full proposal form. They don't have as much detail as some of the things that we have already received. And so what we've been trying to do is figure out, is there an avenue for the people that are making the request through one of our agencies? And so we've been, prior to disseminating all of these proposals to all of you, what we've tried to do is work with either DHS or with Department of Commerce or, with the Department of Ed, just to see, are there other funds available? Is there another source for this entity? And then sometimes the entity in the meantime has already found other funding. So anyway, I hope that Bill, does that do kind of a good explanation of where we are. And the governor has received some requests directly. So what I've done is I've put all of these together, and I'll rattle off kind of a list of basically the types of requests that we've received, or the various entity groups. Let's see, that we have received requests from. As Secretary Walther mentioned, we did get a request from the cities and counties, it's what we keep calling it, but the Municipal League and the Arkansas Association of Counties sent a request, and it does have some detail in it. It does ask for us to set aside $150 million. Initially, they were requesting kind of for a percentage, so then they've come back with that, and I think there are some things within that proposal specifically related to items that we have dealt with before. So we may be able to get more direction or more definitive numbers from them that would be helpful. And then let me just kind of read off the others. We did receive a request from related to the Marshallese population. And so I've done a little bit of investigation with Department of Health on that to see, are there some, they're wanting assistance with testing. Well, we already know that's covered. So, there's some things that we're looking for to get answers for that. We believe we'll be getting a request from higher ed to basically, they're calling it to reopen higher ed. And so this is so that kids can go back to college, so we can cover testing and social distancing and how to deal with getting schools back in the fall, colleges back in the fall. We do need to cover broadband. We don't have a specific proposal yet related to broadband. And so if any of you are experts in that area, we need to make a determination. I think we have some of us have an idea potentially of how much that might cost. We also need to look at the public broadcasting. I don't know, is it ATN or PBS or jointly ATN? So because there are some areas where that's where the children are getting their schooling and they don't even have access to that. We've received a proposal from EMS and ambulance, and that is being reviewed right now, I think by DHS, Yes, I think Cindy and Dennis are working with them to kind of assist in making determinations on that. A group of developmental disability providers have put together a proposal for a request. We have a request from the Black Hall of Fame. We have the amount of money that Dr. Smith mentioned in his original proposal related to vaccine administration, that he decided that they didn't want to make that request now, but it was $29.6 million. But we didn't approve it because he didn't request it, but that may be something we want to consider holding on to in the event that we will need those funds later. Arkansas Department of Workforce Services, they have provided with a request to us. So I will package up all of these pieces of information that I've received. Some are proposals, some are letters, and get those out to you. Hopefully that will be early tomorrow. And so you'll have an opportunity to look at them. I think some will be ready to be on our agenda for next week. And so if I can probably let you know if that's what we think, because I think that the FNA has already seen some of these as well. Let's see, was there something else? And then the governor has talked about wanting for us to do a set aside for the fall. And some of y'all have talked about that, and I believe that Senator Wallace asked last week that we have a discussion on that. I think Secretary Walther just mentioned $250 million, that or $300 million, something like that. So now I have just rattled off a million things, and I would like to hear y'all's feedback, thoughts, any questions that you might have, and I'm happy to have some discussion. And I think we would like to make a determination on what we want to set aside for the fall, at least before the end of today. So who wants to speak first? And did I talk too fast?
Secretary Smith for an hour.
Thank you. Go ahead, Representative Allison.
I know we're talking about a set aside for the fall, but is that something that we have to make a decision on today, or we can continue to discuss it? But I know the figure that has been talked about is $250 million. That's one. The second thing is, I think we need to find out exactly where we are, because we approved a substantial amount of money today. We recommended approval for several agencies today. So where does that leave us? Because I'm trying to figure out, is there going to be any money left for entities outside of the state government, because at the rate that we're going, I don't see any being left.
So I think you raise a good question. At the very beginning, I didn't understand. I mean, I know what you're basically saying. Are we going to have money left for anything after we have addressed all these proposals? But I think we will. Just round figuring all of that, I think Secretary Walther mentioned that we would have close to over 180 million if we were to address all of those things by the numbers that we've already, in any of the requests that we've already seen, and then that would be allowing us set aside of about 250 million for the fall.
And so we'll still have 180 million left. Does that include the money for the testing at the state health department?
Yes.
Okay? Is that included in that 180, or that's excluded of the 180?
It would include it.
Yeah.
Yes.
Okay.
It would be inside of that. Yes, Representative Jean?
My understanding was, at the first of the call, and I may be wrong, if we set aside the 150 million for the cities and counties, and we did a 250 million, we would have an additional 183 million left.
Yes.
So that takes care of the cities and counties. Of course, they don't have a written proposal yet.
Right. Well, they do have a written proposal that lists a request for 150 million set aside, because they don't quite exactly know exactly what they're going to need. And then all of those things that I mentioned.
So the Marshallese, higher ed, broadband, AETN, the ambulance services, all that.
Well, and as I say that out loud, I don't know that Marshallese actually gave us a number.
Okay.
So that is something that I'm trying to figure out, is what exactly.
But what you ballparked on all what you just mentioned was under 183.
Right.
I hope so.
Right.
Yeah. Okay.
Right. We would have, all of those are included. Like
those are included?
Yes.
Okay.
Madam Secretary?
Yes.
So some of those, probably most of those were included, like broadband. I had 25 million in for broadband. So we've included a significant number of those. There are some that haven't given us a number, and so we don't have that. I don't remember a number for the Marshallese.
They didn't put a number in their proposal, and so I'm trying to figure that out. Basically, the question is whether or not if anybody in the Marshallese population that doesn't have insurance, that needs to be treated, that has COVID, how would that be paid for? They didn't have the means to pay for that. And so that's something that
I would think the Department of Health or DHS, but probably the Department of Health could give us the best estimate on that. But what I tried to do was to incorporate as much, everything that we know is even proposed in that estimate, okay? And I will continue as I get more information and get updates on some of these that we don't have numbers, I'll put that in there too. But it's still $180 million plus with considering all the things that we did today and those things that are possibly on the table with regard to testing, long-term testing with it the rest of the year, to opening the colleges and universities. Those sorts of things are in these estimates.
Okay, that's good.
Secretary Smith, can I ask you, make one more comment? When you do this document tomorrow, I think it would be helpful to all of us, and I'd be more than happy to work with you on it. We may provide the request, but also do a summary sheet that lists the request and the amount of money on the request of those requests, so that it's you see it all in one place, and we do it so that there's the steering committee itself doesn't have to do it individually.
Certainly, thank you. Yes.
We've already tossed out the number of 250 million. The other thing we have to think about is what is the date in the fall that we're going to hold this money toward. And to me, what probably makes the most sense, since it very well may have to go to ALC, is that we would target at least a week before the October meeting of ALC.
Okay.
Yeah, I would think the last quarter of the year, October 1st, hold it until we get a better idea of how this pandemic is going to affect us in the fall.
I have a question.
Go ahead, Senator Urban.
Thank you. I've been engaged with Secretary Walter on the broadband issue, and I know you said that was $25 million. So are you not including the $2 million for the rural ID broadband program, or is that funding suggested to come from a different revenue source?
Secretary Walter, do you want to answer that?
Yeah, I don't, do we have a formal request on that yet? I don't think we do. I'm a proponent of that, and I've expressed my agreement with that, and I think we need to get it done. It seems like it will be a great leverage.
Let Bill
Yeah,
can speak to that.
yeah, absolutely. I think that number includes that request for $2 million, Senator Urban.
Okay, because I know $25 million was from long-term reserve for Arkansas Rural Connect, so I didn't know if it needed to be 27 or the 25 was included. Does that make sense, Bill?
Yeah, well, there's already 5.7 that's already been set aside, so really it's only about 19.3 for the Arkansas Rural Connect. So that leaves us, you know, the additional funds for. We should be in good shape there.
And I agree with Mr. Gossage that the 25 million is a little overstated. It's probably more like 19 or 20.
Yeah, this is Mike Preston, and I agree with that. I think Senator Urban, it's like 19 and change for Rural Connect, and then add in the 2 for additional program. Larry, I think we're under 25 million. 25 million would be high side, including both of the programs.
Okay, perfect. Thank you, and I'll work with y'all on an official request, and I know we're working towards that. We'll get that.
Thank you. Anyone else have any questions or thoughts? Go ahead.
Well, at the appropriate time, I think we need to put this back in reserve. So I would make a motion, unless there's not support among the committee, of $250 million to be utilized after October 1st.
Thank you.
May I make a comment too?
Yes. Do we want a second first?
Okay, go ahead.
Do we have a second?
I'll second it.
Go ahead for your comment. We'll take that. Go ahead.
Was that Representative Love? Let him go ahead and speak.
Representative Allen.
I didn't have a comment.
Allen, Representative Allen. I'm sorry. I've done that before.
That's okay. But I that wasn't me. I don't have a comment at this time. Can you hear me?
Yeah, yes, I can.
Go ahead, Secretary Walter. Go ahead.
With regard to the $250 million and it being used in the fourth quarter, obviously we'll figure out if there are some critical things that need to be done in the fourth quarter. But I'll again repeat, and I think Secretary Preston would echo this. We understand that money can be taken from the CARES Act and put into the Unemployment Insurance Trust Fund. And we are depleting that trust fund that was pretty healthy before this all started. And I would hope that as we get toward the end of the year that we'll consider using some money if we have it left over, it's not needed for other purposes, that we'll put it in the Unemployment Insurance Trust Fund. That's my comment. And I think the way we're doing it will allow that to happen.
And Larry, this is Mike, I might have some additional information after collaborating with the DWS team later this week on some additional needs there as it's related to the trust fund. We need to look at what the balance is projected to be at the end of June. Might need to be some flexibility there. Otherwise, it would be additional expense incurred by the businesses. So this could be something we need to address sooner rather than later.
So you're thinking we might do some sooner than the fourth quarter than now, but because you would be required to have businesses.
Required to have a certain balance at the end of the year. At the end of the year.
All right.
Okay, so we've had a motion, a second, a little bit of discussion. Is there any other discussion related to the set aside? Go ahead. Someone trying to. Go ahead, Senator Bond.
Will Bond here. I'm in favor of the motion. Just wanted to make two comments. One, obviously, we're going to get more information as we go forward, and we can come back and move the needle if we need to. I think we need to all remain nimble, which is, I think, what a lot of us have been preaching to everybody. Let's remain nimble and willing to be flexible as we get more information. And two, I know Secretary Key's working on it, but I'm still concerned about making sure we get schools open safely in the fall. I know there's a lot of money over at the Department of Ed for that, but whether it has to be teacher recruitment or whatever we need, I think we need to keep that goal, of the focus of everyone's getting schools open, because that's a huge economic development issue.
That's a good point. That's a good point. We can, as we move forward, change these percentages. If we wanted to reduce the 250 to 200, we could do that at a later time. But I think it's important that we set something aside today.
Thank you.
I think the 250 is a good starting point.
Great. Thank you, Representative Allen. Any other discussion or questions? Okay, we've had a motion and a second. Are y'all ready to vote on holding aside $250 million until October 1st?
Aye.
Aye.
Thank you.
Aye.
Aye.
Any opposed? Thank you. That motion has passed. Thank you, Representative Jean and everyone else. So that's good. I think that we've done some good work with that. The last thing I'll tell you about, I know it's time to go, but we have a website. You probably have noticed when we've sent out the media advisories, we have been posting all of our documents. I think I told you that on the governor's website on a link, but we finally got the website up and running, and it went live, I think, yesterday. And I think we can show it. We might be able to show it to you. I think it's AR. There it is. Can y'all see that? So this is he's not sharing it yet. But we have a way that you can make a public comment and that you can present a proposal. And so I think we'll be able to show the picture. I think we are showing you the picture of the website. So here's the place where, as soon as you get on the website, you'll see this little public comment and proposal, and you click the button for comment, you do that, or for proposal, and you have to fill out the information. If you're trying to submit a proposal, you do need to put your email address in there, because obviously we need to be getting in touch with you in order to give you money. And you will receive an email back from our system with more directions on how to, what you need to do in order to submit a full proposal, because we'll need more information than just, your name and what you want. Then all the committee members will receive something that's called a weekly digest. It will be a link that you can click on, and it will show you all of the comments and all of the proposals that have come in over the past, since the last time. You can also follow that link at any time and log in just by going through your, you log in once with your email address and it'll recognize you. And so then you can read comments every day if you want to see what is going on. So, and as you see, the meeting information is kind of on the right side of the screen. It shows for today, it says next meeting, and it shows today's date, and then all the meeting materials. And you see those are actually the same names as the ones I emailed out to you. So if you would click on each one of those, you would see that information. So it might be handy for y'all as well, instead of having to log in your email to get it this way. But then this way, the public can have an opportunity to see it. The press has asked for this. We also will be providing all of those proposals that we've received today to the press as well. So we'll put all the past meeting information on there. It's not quite all loaded yet, but it'll get there. Does anybody have any questions or want any information? But you'll find this through the governor's website. Okay, thank you. Yes, go ahead, Representative Gray, thank you.
Thank you. Just one question. I know we had talked about cities and counties and 150 million. And
yes.
They had asked for it to be set aside.
Right.
Is that something we need to discuss today, or are we going to wait for that next week, or hopefully they'll have us a final proposal?
I was thinking, since we received that proposal, it came in about 4:25 on Monday.
Okay.
And I had already prepared everything for today's meeting. So I decided to wait, and I'll go ahead and send that to y'all tomorrow morning, so you'll get a chance to look at it. I think DFNA has it, so they'll get a chance to review it, and then we can have them available. We'd like to allow for the representatives from the Municipal League and the Arkansas Association of Counties to be available to answer questions. And then if there's any information that we can discuss with them in the meantime, because we want to make sure that there's the issue related to lost revenue always comes up, and we have to make sure that we are not taking any CARES Act funds towards lost revenue under the coronavirus relief fund. That is strictly prohibited.
Thank you.
Okay.
Okay. Anything else? Otherwise, I think we'll be adjourned. Thank you.
You need that.
I'm good.
Okay.
Thank you.